Yeah, so it's great to be here. Great to talk about what. So David has suggested. David and I had a chat about what should we talk about. We focus a lot, obviously, on the effects of iron deficiency anemia on the mum, and rightly so. But we mustn't forget that there are significant implications on the fetus and the neonate, which we tend to overlook as obstetricians. So I hope that by the end of this presentation, I will convince you that iron deficiency anemia is pretty dangerous for the developing fetus and the neonate. I'm Etienne Chandra. I'm a consultant obstetrician, and I lead the obstetric hematology service in Leeds. I'm also very happy to be involved in Panda. So, just bear with me. Right. So this has already been touched upon by Sue. So anemia in pregnancy is common. About almost half the world's population, pregnant population, is anemic. So it is obviously a very important condition, which this audience doesn't need to be lectured on. And the vast majority, 90% of anemias, are due to iron deficiency. If we look at how it is distributed across the world, luckily in Europe we have one of the lowest prevalences, but still it is not insignificant when you consider that 25% of our women have iron deficiency anemia. But obviously we take care of women from all over the world, including areas where iron deficiency anemia is much more prevalent. So let's start talking now a bit more on how this impacts the fetus and the neonate. So the fetus receives iron through the maternal circulation, obviously through transferrin, which then binds to the transferrin receptors in the placenta, and through various stages is then given to the fetus. Now, we always say in obstetrics that the fetus is the best parasite. So the fetus is able to get as much as it wants from its mum up to a certain level. So when a woman is iron deficient, the transferrin receptors in the placenta are increased, which will maximize the amount of iron transferred to the baby until a certain limit is reached. The maximum most iron transfer occurs after week 30 to the fetus, which actually matches the time in the pregnancy where iron absorption is best in the mum. So that works quite well. Now, in the fetus, this iron tends to be prioritized to hemoglobin synthesis more than iron deposition in neurological, in the neural tissues, in the muscles, etc. So when there is iron deficiency anemia, you tend to see it quite. So essentially, when the baby is iron deficient, there's already a significant reduction of iron in its neural tissues. So we all know that iron deficiency anemia has various consequences on the mum and on the fetus, as well as health economic aspects related to that. And I will be focusing mainly on the impact of iron deficiency anemia in the fetus, as I said, and in the infant, as well as touching upon the health economics of this condition. So there is quite good evidence now from various papers from across the world, from all over the place, for over many years, that iron deficiency anemia can have significant effects. It does, for example, increase the risk of miscarriage with hemoglobin levels below 90, so not particularly low. It does increase the risk of having a smaller baby, and it does increase the risk of preterm delivery. When you have significant iron deficiency anemia, which we don't tend to see very much in this country, that will have an effect on placental function. And low hematocrits, some studies have been associated with medical abnormalities, growth restriction, and even fetal death. So, for example, one particular study suggests that a hemoglobin below 80 increases your risk of fetal death from 1 to 2% to about 5%. This is a study which was published a few years ago on transfusion, in which they looked at almost 100,000 deliveries, out of which 75,000 were included, and 10% of these women had iron deficiency anemia. So a big amount of patients. The cohort was quite solid. And as you can see here, your risk of preterm delivery, i.e. delivering before 37 weeks, was 1.5 times higher. So iron deficiency during pregnancy, as we said, is associated with a higher risk of preterm labor, but also low ABGARs, low birth weight, as we've said, small for gestational age, and reduced serum ferritin in the cord blood in the neonates. It may also increase the risk of perinatal and neonatal mortality and damage to the brain. This is quite interesting. When you look at several studies on the behavioral developmental stages of babies who are iron deficient, they seem to struggle. So if you have a baby whose mother is iron deficient, they are more likely to be iron deficient themselves, and that will have an effect on their neurodevelopmental milestones. So studies have shown that these babies have reduced concentration, reduced cognitive function, reduced motor function. And these effects are measurable up to 25 years of age. It's not just a childhood problem. So in the Swedish paper, for example, they looked at over 500,000 children whose mothers showed anemia in the first and second trimester. And these children have been found to have an increased risk of autism, ADHD, and intellectual issues. So the authors recommended screening for iron deficiency in all pregnant women, which is obviously what we do. There's also an association with other mental pathologies like schizophrenia and abnormal brain structure. So this is quite striking. This is a study on the bonding effect between the mum and the babies if there is in the presence of postpartum anemia. So if a woman had postpartum anemia at 10 weeks after delivery, she is less likely to be responsive to her child and more controlling. And when they looked at the same cohort at 9 months, anemic mothers were more negative, less engaged in their goal setting, and less responsive. And the children of anemic mothers were found to be developmentally delayed, which was still evident at 9 months. As I said before, this defect, this delay, is probably seen even in adulthood. And interestingly, anemic mothers who were treated for their iron deficiency behaved like non-anemic mothers. So iron supplementation, treatment of iron deficiency anemia tends to solve this problem. Other consequences of postpartum anemia, as we know, are decreased physical performance, as Sue has already said, increased risk of infections, alterations in breast milk, and higher risk of depression in the mum. So when you look at animal studies on why this happens, this is from rat studies in which they looked at normal rats and iron deficient rats. So if the rat was iron deficient, as you can see in both graphs, there is less iron deposited in the neural tissue of the fetus, as low as 50% less. And why is that important? That is extremely important because iron is required for myelin production, for oligodendrocyte production. Essentially, iron is a prerequisite for the development of the neurological system. So it's not surprising that if a baby is iron deficient, it will show issues. It will show problems in its motor, in its sensory, and in its behavioral development because the neural tissue hasn't been developed, hasn't been formed properly. As we've said already, there's a higher risk of impaired social emotional behavior, poor cognitive performance, visual acuity, and in all the studies which they do on children, they lack. There's a lag in these children. It's not surprising, obviously, that if a woman is iron deficient, then her child is much more likely to be iron deficient, as you can see here. So if the woman is iron deficient, the chance of the baby being iron deficient is about 40%, as opposed to 6% if she is not. And this is another study which pretty much emphasizes the same thing. If there is iron deficiency anemia, there's a much lower score in tests on mental and motor development in the infant. Which is statistically significant. So I hope I have convinced you that iron, therefore, is extremely important for the effective neural development of the fetus, failing which you are likely to have developmental problems in the infant, in the child, up to 25 years of age, which is what studies have suggested. There's also an economic burden, which is important not to overlook. So in the mom, obviously, if a woman is iron deficient, is anemic, she has a much higher risk of requiring a blood transfusion, which obviously has economic implications. She's more likely to get infections, which has economic implications. And she's less likely to go back to work, which also has economic implications. When you look at the economic burden on the child, um, as we've said, there's a higher risk of abnormalities, higher risk of miscarriage, higher risk of fetal death, and higher risk of preterm delivery, which obviously is more expensive to manage. As we've said already, there's a higher risk of developmental problems in the baby. The children will require extra help at school, which has an economic burden. And there has been some studies to suggest that if there's iron deficiency anemia in the child, there's a programming endothelial problem, which will increase the risk of coronary malfunction later on in life, i.e. a higher risk of heart attack and stroke.